Hello everyone. I just wanted to make a quick video about anterior sextant correct working end. So it is important to know what sequence you're going in when selecting the correct working end because as you remember, when you're working on anterior surfaces towards, that means that these are surfaces that are towards you when in the correct seating position. So there's a lot of things that are kind of interrelated. So just as a quick review, when you're working on anterior teeth, you're either going to be working on surfaces towards, which is at 8 or 9 o'clock, or surfaces away, which is at 11 or 12 o'clock for right-handed clinicians. For left-handed clinicians, it's going to be at, your surfaces towards are going to be at 4 or 3 o'clock, and then for your surfaces away, you'll be at 11 to 12 o'clock. Okay, so a lot of things involved there. Patient positioning is also a thing that you have to kind of keep in mind, whether you're working on the maxillary, which means chin up, or mandibular, chin down, and yeah. So when you're working as a right-handed clinician on surfaces towards, let's say maxillary, we're going to be sitting at the 8 or 9 o'clock. So your positioning will look similar to this. The chin will be up, okay? And then you'll create your grasp, ensuring that your middle finger is gently placed on the shank of the instrument. And then when just checking your working end, you can select really any tooth. The key though is ensuring that your handle is along the long axis of the tooth, okay? So you can go ahead and just approach the tooth lightly and ensuring that your handle is along the long axis of the tooth. You see that? The root. So remember that there's going to be an inclination inward of the root for maxillary teeth, mandibular teeth, all except the posterior mandibular molars. Anyway, so you're going to look kind of straight. Your positioning is correct for your patient, and then you're going to go in and actually check. So I like to check between 8 and 9, and essentially I'm kind of hovering over, you can see this, I'm just hovering over the tooth, and I'm checking to see if the lower shank is across or parallel. In this case, it looks across to me. I can see a little triangle of the incisal edge that the lower shank is kind of creating like a little triangle. If I were to check with the wrong working end, the lower shank would be parallel and right in line between 8 and 9, okay? And yeah, so that is anterior surfaces towards. So now I know which is my correct working end, and I'm ready to do my sequence. So as I approach, your sequence for anterior is going to be furthest away to closest, or if you want to think about it as from your dominant hand to your non-dominant hand, which your non-dominant hand in this case would be rolling the lip back. And so you can perform your sequence this way. This is for maxillary. And as you work towards you in your towards position, just ensure that when you're performing your strokes, that you are starting at that midline. So remember, the working end for this instrument is going to be the 1 to 2 millimeters of your tip. Okay, so ensure that that tip is starting at your midline of the tooth. Okay, so on the canine, I'm going to turn my patient towards me a little bit. It's going to be about here. Okay, and with every stroke, I'm ensuring that I'm using a wrist rocking motion, and I'm also ensuring that with every stroke, I'm rolling to adapt. And that is the correct sequence. So you'd work that way.